I will discuss with you the terms of movement, very important topic of the general anatomy. So let's move on. Many terms describe movements of the limbs and other parts of the body, right? You could see this. These are all movements of the body and the limbs, and I will discuss it with you one by one with the picture. Most of the movements are defined in relationship to anatomical position, with movements taking place within and around the axis aligned with definite anatomical planes. Despite the fact that most of the movements take place at joints where two or more bones or cartilages articulate with one another, many non-skeletal structures show movements. And these are the eyelids, lips, and tongue. These are the non-skeletal structures showing movement. So, terms of movement, I will discuss every movement with a very clear picture. Terms of movement can also be considered in pairs of oppositing movements. For example, flexion and extension is the first oppositing pair. Usually take place in sagittal planes around the transverse axis. You could see this. This is flexion and extension taking place at the glenohumeral joint or the hip joint of the upper limb. This is flexion and this is extension, right? And this is flexion and extension taking place of the lower limb taking place at the hip joint. And flexion designates bending or decreasing the angle between the bones or parts of the body. For most of the joints, for instance, elbow flexion consists of movements in the anterior direction. You could see this is the elbow. Follow the laser very clearly. I'm telling you, this is the flexion, which decrease in the angle. This is the decrease in angle. Follow the laser, the elbow joint, but it's the arm and the forearm. And this is the extension, right? This is the increase in the angle. This is the, you could see from here. And you could see the lower limb as well. You could see this here. And extension designates straightening or increasing angle between the bone, the parts of the body. I told you already. Extension generally take place in the posterior direction. The knee joint rotates 180 degree to the other joints is expected. It's exceptional in that the flexion of the knee includes posterior movement and extension includes anterior movement, right? So this is, you could see, this is the knee joint and this is the flexion and extend. This is flexion, this is posteriorly, and extension is anteriorly. This is the exception to the other joints. This is the knee joint. And you could see this extension and flexion of the vertebral column at the intervertebral joints as well. This is flexion, the bending anteriorly, and this is extension bending posteriorly at the intervertebral joints. And this is flexion and extension of the hand at the wrist joint. This is the flexion, and this is the extension, going it back posteriorly. And this is flexion and extension of the digits, the fingers at the metacarpophalangeal and the interphalangeal joints. These are the interphalangeal joints, and these are the metacarpophalangeal joints over here. Right? So this is flexion as we make in the fist, and this is the extension opening the fist. The dorsiflexion and the plantar flexion, these take place at the ankle joint, and the dorsiflexion is the upward movement, and the plantar flexion is a downward movement. Dorsiflexion designates flexion at ankle joint as occurs while walking uphill or lifting the front of the foot and toes off the ground. Plantar flexion bends foot and toes toward the ground as while standing on one's toes, right? This is, you could see this, already told you. So the terms of movement, very interesting and important. Whiplash. This is the whiplash injury with this red car striking from the back or rear to this blue cord, and the injury occurs over here. This is right. This is overextension or the hyperextension of the neck. This is the injury, teardrop fracture and dislocation of the vertebra takes place, and this is torn anterior longitudinal ligament. This is the whiplash injury. This is way with it. So the terms of movement continue. Abduction and adduction movements usually take place in a frontal plane around an anterior posterior axis, right? So let's see. Except the digits, abduction implies moving away from the median plane. For example, when moving an upper limb laterally away from the side of the body, and adduction implies moving toward it. Here you could see this. This is away from the body at the glenohumeral, the shoulder joint, and this towards the body. This is adduction, right? So this is the way with. You could see at the this hip joint as well. This is moving away from the median plane. This is the abduction, and moving towards median plane is the adduction of at the hip joint. And now the digits. Let's see that in the abduction of the digits, those are the fingers. These are the picture of the fingers. Term implies spreading them apart, moving other fingers away from neutrally positioned middle third finger. This is the neutrally positioned middle third finger. As these two digits, the medial one taken away from this third digit, this is the abduction, and bringing it back to the adduction. And this digit, number 2, single digit, moves away from the median plane and bringing it back. And this adduction of the third digit itself, which is the axis in this movement, you could see this is the axis in this third digit. And if this movement itself has to move in abduction and abduction of the third digit at metacarpopharyngeal joint is, like this, and bringing it back would be adduction. The third finger and the second toe, right? In the case of the lower limb, the toes, the second toe is the reference, the axis. The third finger and the second toe medially or laterally abduct away from neutral position. I told you already. Adduction of the digits is opposite, bringing spreads fingers or toes together towards neutrally positioned third finger or the second toe. So now the lateral bending, right, left and right lateral flexion and the lateral bending are special forms of abduction for only neck and trunk. Face and upper trunk are directed anteriorly, this face and neck. You could see this. But always please follow my laser. And I have to say, if you like my lecture, and please do subscribe and like and do comment down below, right? You can comment for future lectures as well. Face and upper trunk are directed anteriorly as head or shoulder bent to left or right side, thus causing midline of the body itself to become bent sidewards, right? This midline becoming bent sideways. In a compound movement, right, we will know that discussion in case of the thumb, it has special movements, very important. This taking place between several adjacent vertebrae, as one can observe by noticing the way thumbnail faces laterally instead of posteriorly in anatomical position. Thumb is rotated 90 degrees relative to the other digits. And let's discuss. This is the abduction of the thumb, right? This is adduction, bringing it back close. The thumb is rotated 90 degree relative to other structures. Abduction and adduction at metacarpopharyngeal joint occurs in sagittal plane, and this is extension and flexion at the metacarpopharyngeal. It occurs and interpharyngeal joints and occurs in the frontal planes, opposing to other movements of the other joints. Hence, the thumb flexes and extends in frontal planes and abducts and adducts the sagittal plane. I told you already. So the circumduction, right? This is the movement in a circle where these four movements are taking place in sequence: flexion, abduction, and extension, and adduction. Or these can occur in the reverse order: adduction, extension, abduction, and the flexion. Here you could see this is the circumduction at the hip joint. It can take place at any joint at which all the aforesaid movements are possible. Hip joints you have seen, and hip shoulder joint. You can go to my beautiful lecture on the shoulder joint. It's got all the movements shown with pictures. So rotation, this is very, very important. Rotation implicates turning or revolving a part of the body around its longitudinal axis. For example, turning one's head to other side, right? This has shown you already. Medial rotation, internal rotation, bringing anterior surface of a limb closer to the median plane, while lateral rotation or external rotation takes anterior surface away from the median plane. So this is, you could see this Abduction and adduction. Already told you this. On this left side is shown the rotation. This is the lower limb. Here you could see this is the midline of the lower limb, and this is the medial rotation, right? And this is the lateral rotation as I described here to you, dears. And this is the upper limb. This is the middle axis, midline axis of the upper limb, and this is the medial rotation, right? And this is the lateral rotation. This is rotation of the head and neck. This is the rotation of the upper trunk, neck and head. So pronation and supination are very, very interesting movements. These are rotational movements of forearm and hand that swing distal end of the radius medially and laterally around and across anterior aspect of the ulna, while proximal end of the radius rotates static, right? This is you could see, and these occur at the radioulnar joints, right? This is the supination. Let's go into divulge into a detail. Pronation rotates radius medially such that palm of the hand faces posteriorly and the dorsum of the hand anteriorly. You could see this. This is the supination. This is palm would face anteriorly, and pronation is other ways. With the elbow flexed, pronation moves the hand such that the palm faces inferiorly. For example, placing palms flat on a table. And supination is the opposite rotational movement that rotates radius laterally and uncrossing it from ulna, returning pronated forearm to anatomical position. Supination and pronation, only radius moves, not the ulna. When elbow joint is flexed, supination moves hand such that palm faces superiorly. I give a memory tip beautifully to remember that supination and soup. One can hold soup in palm of your hand when flexed forearm is supinated, but are prone expected to spill it if forearm is then pronated, right? The soup would be held by a supinated arm, and if it is pronated, it will spill. So eversion and eversion, these take place at the subtalar joints and the transverse talar tarsal joints. Eversion moves sole of the foot away from the median plane, turning the sole laterally. This is eversion, right? And while foot is fully verted, it is also dorsiflex. Inversion moves sole of the foot toward the median plane, turning sole medially. While the foot is fully inverted, it is also plantar flex. This is inversion, this is eversion, right? So follow the laser. This is eversion, movement of the foot away from the midline, and this is the inversion. This is movement towards the median plane. Pronation of the foot is in fact pertains to combination of eversion and abduction that causes slowing of the medial margin of the foot, feet, and the individual having flat feet are already pronated. And supination of the foot usually refers to movement resulting in raising medial margin of the foot, a combination of inversion and adduction. So opposition is movement of the where the pad of the first digit, the thumb, is brought in contact to another digit pad. Here you could see this thumb, and it is moving in this way, like you see this. This is opposition. It touches this. It can touch virtually all the other digits. This is opposition, very important, and it is important in pinching and lifting a teacup or the handle and button a shirt. Deposition is bringing it back. It designates movement of the first digit from position of opposition back to its anatomical position. So the terms of movement, very, very interesting. This protrusion, it's a anterior movement, retrusion, bringing it back, like this chin or the mandible. Protrusion is a forward, the anterior movement, as in protruding mandible or the chin, tongue or lips. Retrusion is backward, posterior movement, as in retruding mandible, tongue or lips, coming back. Here you could see this very interesting protraction and retraction. Here you could see this is protraction and this is retraction. What is this protraction? These are also comparable of obviously terms. Protraction and retraction are brought into use commonly for the anterolateral and posteromedial movements of the scapula on the thoracic wall. The movements of the scapula on the thoracic wall is a separate topic. We'll discuss sometime. That cause shoulder region to move anteriorly. In protrusion, shoulder region moves anteriorly, and in retraction, it comes back. So in protraction, the shoulder region moves anteriorly, and in retraction, it moves backwards. If there was a slip of tongue, I apologize. Elevation and depression. The last slide, right? Elevation raises or moves apart in the upward direction superiorly, for instance, in elevating shoulders while shrugging. Shrugging is done by trapezius muscle tongue when pushing it up against the roof of the mouth, the palate, the upper eyelid while opening eye, right? This is the example of the elevation. And this is depression, right? Depression moves apart inferiorly, and that is lowers it, as in depressing shoulders while standing at ease. This is depression of the shoulders. This was shrugging at the elevation. This is depression. And pulling the tongue away from the palate or the upper eyelid while closing eye. So I thank you very much for watching my video, and please do subscribe to my channel. To request you already. Please stay tuned for more interesting and general anatomy lectures today with this series. Goodbye.